Hey everyone, and welcome. Today, we're going to decode one of the most common and maybe one of the most intimidating medical tests out there, the electrocardiogram. You've probably heard it called an EKG or an ECG. We're going to break down exactly what it is, how it works, and what it tells us about our heart's health. Okay, so when you look at a full readout like this, let's be honest, it can look pretty complicated, maybe even a little bit intimidating, right? It's just this web of squiggly lines with all these peaks and valleys. It almost looks more like a secret code than medical data.
So the big question is, what does it all mean? Well, believe it or not, every single one of those squiggles tells a super detailed story. It's the story of the electrical journey of just one heartbeat. And over the next few minutes, we're going to learn how to read that story together.
All right, here's how we're going to tackle this. We'll break it down into 5 simple parts. First, what an ECG even is. Then, the heart's own electrical spark. After that, how we actually capture that signal. Then comes the fun part, decoding the readout. And finally, we'll put it all together to read a normal ECG. Let's get started. Okay, let's kick things off with section 1. So, starting right at the beginning, what exactly is an ECG? At its core, an electrocardiogram is really just a recording. It's a way to listen in on the heart's electrical activity. By placing these little sensors, or electrodes, on the skin, we can capture the sum total of all the tiny electrical signals that the heart's muscle cells create, with every single beat. Think of it like a completely non-invasive snapshot of the heart's entire electrical system in action. All right, but to really get what that recording means, we first have to understand the spark that creates it in the first place. I mean, where does all this electricity in the heart even come from? It all boils down to something happening at a cellular level, and it's called an action potential. Now, you can think of an action potential as this tiny little electrical event, a spark really, that tells a single heart muscle cell, hey, it's time to contract. And what the ECG machine does is it records the combined effect of millions of these action potentials all firing off at once. But here's the cool part. This cellular spark isn't just a simple on-off switch. It actually unfolds in a few distinct phases, kind of like a carefully choreographed dance. You have different ions, things like sodium, calcium, and potassium, moving in and out of the cell. And this movement is what creates the electrical wave. You get this super sharp, fast spike up, then it levels off for a bit in a plateau, and finally, it resets itself. This very specific, multi-stage pulse is the fundamental signal that the ECG is built to detect. Okay, so we've got millions of these tiny sparks going off inside the heart. How in the world do we capture that signal from outside the body? Well, that's where the electrodes, or what we call leads, come into play. A great way to think of them is like cameras or microphones. Each one is placed in a very specific spot to get a unique view of the heart's electrical field. Now, these leads come in 2 main flavors. You have unipolar leads, which use one active camera to measure the electrical voltage at one specific point. Then you have bipolar leads, which use 2 active points and measure the difference between them. This is really useful because it gives us a sense of the direction the electricity is flowing. By using both kinds, we can build this amazing, almost 3D picture of what the heart's electricity is doing. And this is where the theory becomes practice. On the left, you see the textbook diagram showing the perfect placement for these 6 chest leads, labeled V1 through V6. And on the right, you see how a technician actually finds those exact spots on a person's chest using anatomical landmarks. Getting this placement just right is absolutely crucial for an accurate reading. Now, the leads on the arms and legs create something called Einthoven's triangle. It's a classic concept. By placing electrodes on the right arm, and left leg, we create 3 bipolar leads called lead I, 2, and 3 that form an imaginary triangle right around the heart. This setup gives us a fantastic view of the heart's electrical activity from the front. All right, the cameras are in position. Now it's time for the main event, learning the language of the picture they create. Let's get into decoding this readout. So every single normal heartbeat produces this really distinctive pattern. You can see it's made up of waves. Those are the bumps that go above or below the flat line, and the intervals and segments in between them. The 3 main players you need to know are the P wave, the QRS complex, and the T wave. Let's take them one by one, starting with the P wave. This first little rounded bump, that represents the electrical signal spreading across the atria. Those are the 2 top chambers of the heart. When that signal fires, it causes them to contract and push blood down into the ventricles. Next up is the big one, the main event, the QRS complex. This sharp, spiky part of the wave represents the super fast electrical signal, the depolarization that makes the ventricles contract. And the ventricles are the big, powerful lower chambers of the heart. The sheer size of this wave tells you just how much electrical energy it takes to pump blood out to the lungs and the entire rest of your body. Okay, so after that powerful squeeze, the ventricles need to reset. And that's exactly what the T-wave shows us. It represents the repolarization. You can think of it as the electrical recovery or recharge as all those muscle cells get ready for the very next heartbeat. You'll notice it's a bit of a slower, more rounded wave compared to that sharp QRS complex. Now, it's not just about the shape of the waves. The timing between them is absolutely critical. So the PR interval measures how long it takes that signal to get from the atria down to the ventricles. If that's too long, it might point to some kind of block. The QRS duration tells us how fast the ventricles are actually depolarizing. And finally, the QT interval measures the total time for the ventricles to both contract and fully recover. Let's just zoom in on that QRS duration for a second. In a healthy heart, it's incredibly fast. We're talking less than 0.12 seconds. That speed is a really good sign. It tells us that the heart's internal wiring, its conduction system, is working super efficiently, spreading that signal like lightning across the ventricles to get a nice, strong, coordinated pump. Okay, time for our final section where we put all these pieces together. We are now officially ready to look at a full, normal, 12-lead ECG and actually make sense of it. And here we are, right back where we started, but it doesn't just look like a bunch of random squiggles anymore, does it? You can actually see the repeating pattern, P-wave, QRS, T-wave, over and over. And you can also see how that pattern looks just a little bit different in each of the 12 leads because each one is giving us that unique camera angle of the exact same electrical event. But it gets even smarter. Doctors actually group these leads together to look at specific regions of the heart muscle. For instance, leads III, 3IF, and AVF give them a view of the bottom or inferior wall of the heart. V1 and V2 are looking right at the wall between the ventricles. Grouping them like this allows a clinician to pinpoint the location of a potential problem with incredible precision. So let's just quickly recap the big takeaways here. First, the ECG is the grand sum of all the heart's tiny electrical signals. Second, the leads act like cameras, giving us 12 different views of the action. Third, the waves show us the heart muscle contracting and then relaxing. And finally, the intervals measure the absolutely critical timing of all these events. You know, learning to speak this electrical language is what allows doctors to diagnose everything from a massive heart attack to a really subtle rhythm issue. So now that you understand the heart's electrical story, what new questions do you have about this vital organ?